More importantly, we will be discussing how the strategic implementation of a premarital and marital counseling model like ours can help improve the reproductive health landscape of the country. So now we'll be starting the discussion. And for that, I'll first be inviting the moderator for today's session, Dr. Haris Ahmed. Dr. Haris, may I please request you to come on stage? Thank you, sir. Dr. Haris possesses more than 20 years of work experience in FBRH sector. He has been team lead for SOOK initiative, deputy lead for DAV PK, and director programs for Pathfinder International. Currently, he is representing the Forum for Safe Motherhood as a public health specialist and has developed Aghaz and its related resource material along with his team. Okay, our first two panelists today, Dr. Sabina Durrani, Director General Population Wing of the Ministry of National Health Services, and Dr. Talib Lashari, Technical Advisor of Costed Implementation Plan, Population Welfare Department, Sindh, will be joining online. They are both actually attending a meeting of the World Bank, which kind of like came up at the last moment, and will be joining us somewhat late in this session. So now I will be welcoming our next panelist, Dr. Fauzia Khan, and I would like to invite her to please come on stage. A psychologist by qualification, an educationist by profession, and a media personality by interest, Dr. Fauzia is an avid researcher and practitioner. She is currently serving as the head of curriculum wing and additional director with the School of Education and Literacy Department, Government of Sindh. Thank you, ma'am, for joining us here today. I would now like to invite our next panelist, Dr. Yasmin Ghazi. Ma'am, please. Dr. Yasmin is a well-known reproductive health expert in the country and has remained an active advocate for women's health issues for more than 25 years. She is a board member of PPIF and has been associated with the Gates Foundations since 2015, first as Senior Technical Advisor and now as Senior Advocacy Advisor on Family Planning. Thank you, Dr. Yasmin. We are really pleased to have you here. Our next panelist is Dr. Qudsiya Uzma. May I please request Dr. Qudsiya to come on stage? Thank you, ma'am. Dr. Qudsiya is a medical professional with public health training. Currently associated as a national professional officer with WHO, she has experience of working with the UN, Save the Children Pakistan, and also the country's public sector. Thank you, ma'am, for joining us. I would now like to invite our next panelist, Ms. Shazina Masood, on stage. Ms. Shazina Masood is the Chief Executive Officer for Aman Healthcare Services and the board member of Sindh Integrated Emergency and Health Services. She brings over 20 years of experience in private sector marketing and sales, including experience in social marketing and social franchising of reproductive health products and services. Ms. Shazina, we welcome you here. Thank you. Now, last but not the least, we have our final panelist of the day, Ms. Sheena Hadi. May I please invite you to join us on stage? Thank you. Ms. Sheena Hadi is the Executive Director of AHANG. She also serves on the Gender and Advisory Panel of WHO. Ms. Sheena is also the proud recipient of the Dunlop Award, which has been conferred upon her for promoting the health and rights of women and girls. Many thanks to all our panelists for being here today. And now I will be giving the floor to Dr. Haris for taking the session forward. And sir, I do hope you're not feeling intimidated by all this girl power. You happen to be the only guy on stage.
Okay, thank you very much. While they said the presentation, I really like to thank every one of you. Unfortunately, this was a very early time for very good audience to be here. It's a very interesting subject, and all of you have contributed in making it a reality. It would have been good, but I'm sure that SOGP is recording these sessions live, and they will be online available for audience, and Dr. Lima can confirm that they will be available for. Okay, so we can have the presentation up. So before, till the time we get the presentation up, I really like to thank personally one person who actually gave this whole thought and the idea and that's how we were able to develop this model, and that is Shazina. Thank you very much for giving this idea of multi-touch sensitization, and we took this idea and applied it here, and really, I'd like to make sure that I'm acknowledging you and thanking you for giving us this thought. So the multi-touch sensitization, how will it will have? Achha. Okay. So the right word that represents that group of couples that we want to reach out to and sensitize them on the family planning and reproductive health. Uh, what we went, this was a consultancy given to Forum for Safe Motherhood by WHO in collaboration with the Ministry of National Health Sciences. So we had a very the methodology applied was more interactive, going through not only doing a rapid assessment of what the couples or young generation feels about, but also we had South Learning Education Forum, which was recently established by WHO, and we had a meeting and online meetings with Sri Lankan team and also with the headquarter to understand more. I'm really sorry if you would like to can be back in this, or is it okay? Because we unfortunately this was supposed to work. This thing. Yeah, I think it will be good. Okay. So it's just few slides. Uh, so we also had a consensus workshop in Islamabad, inviting all the four provinces, departments of health and population, and the two other AJK and Gilgit-Baltistan officials, and the development sector partners, NGOs, to share the whole concept and to have their feedback on it, and then finalize it. So what this model is actually about. So the reason I compliment Shadina, because this is the thought that she gave. It was about multi-touch. So what are the points of touch that the couple has and that needs to be sensitized? So it starts from individual. So at individual level, it has to be you have access to mobile, you have access to handouts, you have access to telehealth. And when you go out at the level of institutions, schools, you have access to life skill based education, you have access to web portals and internet. And when you go out for services, you have access to healthcare providers, especially we have lady health workers, religious leaders, what we call as the gatekeepers. And when you go, to the facility level, sorry, that's the community level. When you go to the facility level, you have the healthcare providers, the pharmacists, and the adolescent center, counseling centers that have recently been developed. And then you have the CSOs, local and international, working within the community who can sensitize. So these are all the multi-touch points that a couple actually interacts at different level. And through this interaction, if these touch points have that sensitization and are geared up, and they have that understanding of how to provide this information related to premarital or marital counseling, then it's very easy to reach to the couples. So it's not only one person in the whole arc, but everyone there who is responsible. And that's why we have the panelists here would now know how they fit into this multi-touch point approach. So for each touch point, we had developed different modules in Urdu for now, and we'll be translating them into Sindhi also. So we had a handbook for the couples, which gives them basic information on reproductive health, family planning, roles and responsibilities of husband and wife. The resources, we did not reinvent anything. We took all the material that was available. UNFP had just developed a training curriculum for on premarital counseling for healthcare workers. Ahang has a life skill based education modules. Telehealth, Aman Telehealth has a very comprehensive algorithm for telehealth. So actually, we used all what is available and just compiled it in a way that was easy to understand for different segments in the multi-touch point. Okay. So we developed a web portal which is now being uploaded. The link is now being uploaded into the Ministry of National Health Sciences, and it's available. So the web portal has all the information that's available on premarital counseling. It's in English now, and the Urdu translation is underway, and we'll be translating this into Urdu and Sindhi, two languages. And this is you can please see the link www.agaz.com.pk, and it is available for everyone to see. We have also developed a mobile application with the same information, and it's available on Android for a download at Google Play Store. So that again is in English. I just try to shorten this discussion because we have a panel to talk to. This was not only something that the project had done, but it was really well appreciated not only by the head of WHO in Islamabad, but also by the Director General for Population Planning Wing in Islamabad from the ministry. And most important, this was appreciated by the President of Pakistan during his speech at the international conference for population for the international conference, where he said a very good initiative has been launched when married or to be married couples are provided counseling and guidance to how to take their fertility phone. This is a complete package. Will prove fruitful because we want to ensure that that this. Yeah, you can read it. Yeah, sorry for me. It's so difficult. And family health care is addressed in full, including child vaccinations, nutrition, and frequent pregnancy. So I think that was the most highest level of acknowledgement to this package. We are looking forward to WHO to make sure that the dissemination of Agas, because I think it's not that much known, at least at the provincial level, so it needs to be widely disseminated. We take this opportunity of SOGP to make sure that we can start talking about it. So this was a brief outline of what Agas is, and I really like to thank every one of you for your contribution to having this. We made sure that that all modules have appropriate acknowledgement of all those materials that have been used in compiling them. From now, I move to the panel discussion. But before that, anyone here would like any question, or we move to the panel?
So you spoke about two languages, Urdu and Sindhi.
Yeah.
What about others?
So we have we have a inch to go for Pashto and other Saraiki probably, but they are not very much read in terms of
Okay.
the audience. Usually they good with Urdu, but in Sindhi, that's a language that's actually read. So we are going for initially we are going for the languages that are more read in the. They have an audience who read them actually. For Pashto, it's more listened than and talked than it read. Dr. Yasmin.
Yeah, so congratulations. This looks like great initiative. I haven't seen it on the website and all that. So yes, we need dissemination. I was asking Kutsia, so I'll ask this to you as well. That how do you track its use? How do you know it's being used?
So we did an impact study before last in November, and we had about 200,000 users. We did a tracking of the people who watched this. We had also done some analysis. We went to the universities and community organizations. Especially, we went to a church where we introduced this web portal, and then we got back to them after a week to see what they have learned, and we found out about 98% of the improvement in their knowledge and understanding on the subject. So that was done in there was it's not we did not do a very structured study, but maybe at some stage, once we have, so I think, there is an assessment plan that's going to happen. But we still are looking at the clicks that are, who the number of people who are reaching out to this web link.
One is mine.
Okay. 201. Yeah, Dr. Ali. So it's a comprehensive. It's for everyone. It has all for service providers, all the methods, details of all the family planning methods, which are available on net, so they can look at them, and they can understand the side effects and everything. All the family planning methods are there, including the side effects and the quality of service and everything. It's for both.
So it's include family planning mostly.
Yeah.
What about the other? Because it's pre-marital, so I was very interested in close family marriages and how to guide them for blood groups and thalassemia.
Yeah, so everything.
Is there
It has
information there as well?
everything. It's a thalassemia. There are some questions also that you can click, and some usual questions about roles and responsibilities, about the mother-in-law, and about how to be a good wife, how to be a good husband, what expecting, housekeeping.
And also
Yeah.
gender.
Sorry?
Also about gender.
Yeah, gender.
Okay, thank you.
It's very comprehensive, about 10,000 words. Okay, thank you very much. And anyone here like to have any? Madam, please.
Assalamu alaikum, everyone. It's a very good and innovative idea. I have a question that you said that it's a multi-targeted, yes.
Multi-touch.
Multi-touch, okay. So what strategies are in pipeline to sensitize the healthcare providers, and how to take this at the grassroots levels? Because this web, most of the population, they are illiterate, and they might not have the access. My suggestion is that it should go to the grassroots levels, like particularly related to the healthcare providers. That's that's I need to know.
Okay.
Thank you.
So for healthcare providers, what we have done is that we have through UNFPA has trained about I think nearly 30 or 50 healthcare providers in the capital, and they are planning to do more in the provinces. They have, for the private sector, they have done trainings with Green Star Social Marketing. So they have a manual and they have a strategy to train, and the federal ministry is looking after the roll down training. Since we have developed these modules and these brochures they are all available online. You can click and see them. So what our next step is to to extensively print them and make them available. What we have learned over the years that recently with the mobile applications and Android being very much available with nearly everyone who uses a cell phone. We are trying to promote more the mobile application that we have, because that once it is translated in Urdu, it's easy for even the lady health workers and other health professionals, including the community, to access and use it. So, hard copies to print and distribute may not have that same result, but an interactive mobile application would have more impact.
We have introduced here first time. So first of all, the healthcare providers, starting not the tertiary level hospital, but the primary care levels and the community workers. I think they should be involved in it, and in a very easy way, and they should be like sensitized to the things. What is that? क्योंकि आपका इसमें बहुत सारी चीज़ें हैं, इसमें आपकी काउंसलिंग भी है, आपका उसमें जैसे बहुत प्री-मैरिटल वी आर फेसिंग थैलेसीमिया काफ़ी हाई है हमारे पास, एनीमिया बहुत है, तो इन चीज़ों सिंपल चीज़ें हैं, बहुत सा मतलब ये बहुत ब्रॉड है, तो उसको सेंसिटाइज करने की ज़रूरत है मेरे ख्याल में. जो हेल्थ केयर प्रोवाइडर हैं उनको सबसे पहले, तो देयर शुड बी सम प्लान फॉर दैट. थैंक यू.
हम दो लेवल पे कर रहे हैं. एक तो मैडम ये है कि पॉलिसी लेवल पे निकाह रजिस्ट्रेशन में प्री मैरिटल काउंसलिंग को इंक्लूड करना, ये जो काउंसिल ऑफ कॉमन इंटरेस्ट के एक्शन पॉइंट्स हैं उसकी रिकमेंडेशन के अंदर भी है, और फेडरल मिनिस्ट्री प्रोविंशियल गवर्नमेंट के साथ मिलकर इस पे काम कर रही है, और पेशावर में उन्होंने इस पे एक पायलट स्टडी भी की है कि निकाह नामे में, ताकि निकाह से पहले वो उनको बता सकें. इसमें मैडम हैंड मॉड्यूल भी मौजूद है खतीब उलमा के लिए, जो कि तमाम मज़ाहिब से हमने जिसमें हमने क्रिश्चियन, हिंदू, भाई, मुस्लिम और डिफरेंट अकीदों को भी हमने उसमें शामिल किया था। उन सब की मुश्तरका जो मुशावरत से हमने ये बनाया था, वो इसमें मौजूद है, और उनके लिए सॉफ्ट कॉपी भी उनको हम दे सकते हैं। अभी जो हमारा नेक्स्ट स्टेप है, वो पहला तो यही है कि हम इसको निकाहनामे में लाएं, क्योंकि वहाँ पे कंपल्सरी जब होगी चीज़, तो उस तरह आप जैसे आपने देखा कि मैरिज, अर्ली एज मैरिज जो है वो अब उसमें आ गई है, तो उस पर एक्शन लिया जा रहा है। इसी तरह ये जो है पॉलिसीज जो है रिप्रोडक्टिव हेल्थ बिल, डॉक्टर यास्मीन बता सकेंगी, इसमें सिंध के अंदर तो प्री मैरिटल काउंसलिंग को इंक्लूड कर दिया गया है, और पंजाब के अंदर प्री मैरिटल काउंसलिंग का जो रिप्रोडक्टिव हेल्थ बिल है गवर्नमेंट का, उसमें इंट्रोड्यूस किया जा रहा है। तो पहला तो ये है कि पॉलिसी लेवल पे ये आए, ताकि हम फिर दूसरे लेवल पे जाएं हेल्थ केयर वर्कर्स पे। हेल्थ केयर पे ऑलरेडी काम शुरू हो चुका है, क्योंकि इतना बड़ा अभी हमारे बहुत सारे हेल्थ केयर वर्कर्स हैं, और हमारे लिए मुश्किल है कि हर एक के पास जा सके। हमने इसलिए इसको वेब पोर्टल और मोबाइल ऐप पे लेके आए हैं कि एनी वन कैन रीच आउट टू इट। सो जस्ट टेक 5-10 मिनट्स एंड गो थ्रू इट। फॉर ए प्रोफेशनल उसको इतना टाइम नहीं लगेगा, और क्योंकि इसमें काउंसलिंग के मैसेजेस भी हैं, तो वो बहुत आसानी से वो कर सकते हैं। बट यस, दैट इज द नेक्स्ट स्ट्रेटेजी टू रीच टू द मैक्सिमम। जी, ओके, वी स्टार्ट विद द पैनल। सो राफिया इज, आप एक वो हैं डॉक्टर सबीना या नहीं, किया डॉक्टर तालिब ने, तो वी कैन स्टार्ट। So I thank you very much. I like to first start off with Dr. Yasmin. So the question I shared with you was, how beneficial do you think premarital counseling can be in terms of educating couples on importance of healthy timing and spacing of pregnancy? Because there's a concept of premarital counseling is mostly thought for in terms of sexual dysfunctions, and to prevent marriage breakups. So how you think that can change into a healthy timing spacing pregnancy counseling?
Thanks for this question, Haris. And I think there is enough evidence, both globally, both locally. Locally, when I say, it means the groups who have tried to engage with young people even before they are married about educating and sensitizing them on sexual and reproductive health and rights. Because it is very clear that if you look at the conventional way that our youths get education, first of all, not everybody goes to the school in Pakistan, so we should realize that. Because I was seeing in institution, of course, life skill based education could be a great tool to change that perception and behavior around sexual and reproductive health. But not every child is lucky enough to be in school, or to be in a school where such education is being given. So I think providing this multi-touch approach and thinking about what are the touch points for a young person's journey, where they would be have the facility or the space to interact with someone who can talk about sexual and reproductive health. And the marriage has been taken, I think, as a parking point, because for all of us in the region that we belong to, it is like a major milestone. And this is a kind of a perception, and a bit of reality also, that the sexual and reproductive life begins when you are married, and that is when. But even when we feel that this is a point where every young person, whether girl or a boy, would be starting the sexual life and would be entering into a reproductive health space, no one from us think about educating them on this very important aspect of life. I mean, we try to tell them other things which are important, like for girls, of course, there is a huge sensitization which is given by the family. You're moving to another family. What does it mean? And it's important. And these are life skills. What does it mean? How do you manage those relationships? How do you move to that in a family? But no one talks about that, how do you start planning your family? And then again, it's a discussion that needs to take place between the couple. So yes, you sensitize them, you educate them, so they have enough information, and they have the skills to engage with their partner before, if not before marriage, soon after marriage. about the things that matter most. So, we say that we plan for everything in life normally. So, if there is a wedding, everything will be planned. There's a budget, there is, who will be catering, where the meal would come from, who will be the photographer, what clothes we'll be taking. But no one is teaching those young couple about planning their own life when they enter into that space. So, it is hugely beneficial that you have enough information, and it's not about, everybody thinks that we as family planning advocates would always be saying, oh, have less children, have less children, have less children. And it's kind of a, it can be a worse also. No, it's about managing your own fertility and managing your own reproductive life in a way that is going to be not only helpful for you as a couple, but the children you're going to have. So it's about spacing, it's about having good health, and it's about all other things related to it, and of course other things that are related to sexual and reproductive health. So yes, I would say that this is something that we have been talking to the ministry and to all the organizations that are working on it from a very long time. We are very happy that it's part of the CCI recommendation. We are very happy that federal ministry, thanks Kutsia, the WHO, and Safe Motherhood, that all of you and many others who are sitting here have started taking initiative, because you have to really test and try it out. The biggest challenge is how do you capture those who are getting married at a right time? How do you engage with them? How do you make them realize? How can you do it in a socially and culturally acceptable way? And if and the reason I think YSN has dropped pre and same marriage counseling, although personally I feel it should be pre-marriage counseling, is that if you are not able to do that as a couple before they are married, then you should try to make them, or you know uh, reach out to them as soon as possible, not before the girl is already pregnant and they're already like into it. Even then I feel that if catch them, it would be, it's going to be really helpful for them. So I think unless it is rolled out, it should be rolled out in a different models, I would say that. So you have touch points, and you start collecting and looking back at the results and see, okay, how can we improve that, how can we do it better? But without civil society, without community engagement, without NGOs, without youth groups, and absolutely without primary caregivers, you cannot make it happen. It is not something that we feel that a doctor and a specialist is going to be involved with. They come at a later stage. So you have to involve them. And I just close by saying the global evidence, when I said Iran is a model, Iran is a very religious conservative country. When they brought it as a policy that no couple can get, nikahified unless they have gone through a pre-marriage counseling, which is huge, which is not just family planning, it's about all other things. And they have seen, I mean, and they say the attribution is that 70 plus CPR is because the young people are sensitized at the right time, and not like our traditional family planning program when we reach a woman and she already has like 10 pregnancy and 8 children and 6 abortions. So you don't try to educate them at a time when the time is already lost. So I think it's going to be very interesting to turn. And then don't forget, Pakistan is a very young country with the demographic dividend, with so many young
Young
people
people,
in
yeah.
reproductive age and life. This is something that needs to really not only rolled out but do it in a very effective manner. Thank you.
Thank you, Dr. Yasmin. And I have a follow-up question with Sheena, but I think Dr. Talib is online. So, Dr. Talib, Assalamu alaikum. Can you hear us?
Yes, I can hear you. Good morning, everyone. Can you hear me, Dr. Harris?
Dr. Talib, आपकी आवाज नहीं आ रही है. Mute now.
I couldn't connect through my laptop, so I'm on cell phone. I'm trying to.
नहीं,
On my mic is on.
डॉक्टर उन नहीं उनको रिंग करके बता दें. Okay, so I go with my follow-up, Sheena. So जहाँ डॉक्टर यास्मीन कह रही हैं कि young couples को reach out करें, तो Ahang has been working with young couples for now, like I think more than 2-3 decades now. So how is your experience? And you have also developed the life skill-based education module. Is it open? So Sheena, how Ahang feels about the young people and their response to the work that you have been doing with them, especially in sexual reproductive health and the life skill based education? Is it only telling about puberty and knowledge about self care, or it is talking beyond that?
Thank you, Dr. Harris. So I'll answer the second part of your question first, and then draw a link to the premarital. So no, in short, the answer is that we're not just talking about puberty. The life skills-based education actually is supposed to be an education program which builds from an early age. So now Ahang actually does its life skills-based education program starting from age 4. And the reason is because in an age appropriate manner, build information and skills in the child that is required at that time and then for the future. So with a young child, you can start with just actually having them understand, my body is mine, what is body protection, celebrating the body, those kinds of things, which then we build on. Puberty does come in, of course, and that's a very critical point. And when we talk about premarital counseling, we talk about family planning and all of those things, it's very challenging. What we have to remember is that it's very challenging to provide all of this information at one time. So if you have a young person who is either just getting married or has just gotten married, and that is the one point at which you decide you're going to give them all of this information about their body, about family planning, about gender, about violence, about respect, about finances, all of these things, there's only so much that the young person can process and actually act on at that time. So the whole purpose of life skills actually is to, in an age appropriate manner, build those skills. Those skills are about decision making, about negotiation, about asking for help, about being able to identify there's something wrong with me. Who do I go to? What am I supposed to do? Getting counseling, seeking out healthcare. And then, of course, with that is all of the information. So, for example, how does this connect to family planning? Do we talk about contraception to 13, 14, 15-year-olds? No, we don't at that point. But what we do is talk to the young people about what is the concept of a family. So in your household, how many children are there? What kind of influence has that had on your life, on your parents' life? Has there been challenges because of that? So that even the concept of family planning, what that means, what does it really mean to plan a family, has to start coming in early on. Because if you try to go in all at once, it's not as though a young person, especially a young woman who's gone through years of probably, having subtle or more obvious gender discrimination occurring in her lifetime, is going to be able to start making active decisions about her body. That's not going to be possible. So I think that's why it's such a critical run up to if we're going to be doing things like premarital counseling.
So one question before I would like to move to Dr. Fazia for on that. How is your audience receptive? How much are they receptive?
We've seen is that young people are very receptive. They're very, very hungry for this information, especially with regards to things like puberty and development, but across the board also, they're hungry for this information because they're not getting it from anywhere. And the most important thing that we found with regards to how the information is received and perceived is really who's delivering it. So if you have a well-trained educationist who's delivering that information and engaging young people, because again, the whole purpose of life skills is not just to throw information at them and say, okay, now it's done, right? You know it, and so now go ahead. The whole idea is to engage in dialogue, in conversation, in thinking, so that the young person can figure out what does it mean to make a decision. And that's not just, again, with sexual and reproductive health and rights. It's also with regards to bullying, with regards to gender discrimination, violations, all of those things, drug use, smoking, etc., etc. So it is very well perceived. We've run it successfully all the way across Sindh, in parts of Punjab, in starting in Balochistan, in Gilgit-Baltistan, as far as that. So it's very well perceived, and the evidence really shows that young people are not just absorbing the information and knowledge, but they're putting it to use as well.
Thank you, Sheena. So I take this point further to Dr. Fazia. Dr. Fazia, what is the Department of Education and Government of Sindh doing? We not only in Sindh, but I think as a responsible, public health person that you are, how you are scaling it up to the other provinces. So taking these best practices. So first the Sindh chapter and the scaling up.
Thank you so much, Harissa. So I'll start with back in 2014, Sindh Assembly passed School Education Standards and Curriculum Bill. Now the main preamble of that bill was integration of 21st century learning skills into our system, into education system. शीना ने बहुत अच्छी तरीके से define कर दिया what exactly are the life skills. So basically, one of the skills of 21st century learning is the life skill based education. So the department, we started working on it. Luckily, Ahang Aya on board, and then the SOAP project. So that's how we started. Initially, बहुत सारे मसाइल थे. There were protest against us, against Ahang, और बड़ा मसाइल हुए सारा. But gradually we realized that it is doable. It is doable because हमारा approach probably वो सही नहीं था. We were directly, हम contact कर रहे थे with the child or with the parents. Then we realized कि नहीं, पहले parents, teachers को on board लेना is important. So gradually we realized कि नहीं, if a teacher is properly trained, only then he or she can, transfer this knowledge to student. अच्छा, उसमें फिर unofficially बहुत सारी चीजें हमारी चलती रही. We were focusing on integrating the relevant material into our curriculum, into our textbooks, and gradually हमने उसको लेकर गए हम teacher training के लिए भी. फिर उसके बाद अभी तक, right now, the position is that in Sindh School Education Department, we have trained more than 38,000 students. 38,000 teachers. They are trained on life skill based education. जी बिल्कुल. And then moving on from life skill based education, WASH was an integral part and is integral part of life skill based education. उसमें फिर then we started focusing on specifically on MHM. MHM के लिए integrating, relevant material into textbook was not possible for us.
Can you spell out MHM?
Sorry, menstrual hygiene management. Sorry. So वो हमने जब start किया तो वो within our जो हमारे tax departments हैं उन्होंने बड़ी resistance show की कि आप बच्चों को ये पढ़ाएंगे ये. फिर we decided कि नहीं, teachers से start करते हैं. Let's train these MHM master trainers. So अभी भी हमारे पास सिंध में we have more than 500 MHM master trainers available in Sindh, and they are directly जो बच्चों के साथ adolescent girls especially उनके साथ they are working on it with them. इस वक्त so this is a brief background. Now LSB training is now mandatory. जो भी we have this Provincial Institute of Teacher Education in Nawabshah. So it is mandatory for PI that LSB should be incorporated in each and every training for teacher, because PI is responsible for induction training of teachers, for promotion training of teachers. It's now a mandatory component. In 2019, in collaboration with UNFPA, we started working on developing a LSBE curriculum framework. और उसको हमने जो एक यूनिवर्सल डॉक्यूमेंट है वन करिकुलम का, उस पर भी वर्क एक्सटेंसिवली ऑन दैट डॉक्यूमेंट, बिकॉज बहुत सारी चीजें थी विच वाज नॉट रेलेवेंट इन आवर लोकल क्या बाकी कॉन्टेक्स्ट में भी वो हमारे लिए एक्सेप्टेबल नहीं था. हमें पता था कि हम इस चीज को ऐड तो कर देंगे लेकिन हम उसको कभी इम्प्लीमेंट नहीं कर पाएंगे. So civil society was on board. आपने बात की कि हमारे जो different religious जो हमारे leaders हैं, they were on board, they were part of those consultations, और उसके बाद भी notified that document. So अब जो भी curriculum बन रहा है, कोई textbook बन रहा है, कोई teacher training हो रही है, LSB is, you know,
The part of it.
prominent feature है उसका.
No, I think
quickly.
जी जी
Next
बिल्कुल
part, बलूचिस्तान ने
जी।
हमें कांटेक्ट किया कि जो एलएसबी का सिंध में काम हुआ है उस पर उन्होंने किया, और इसी तरीके से केपीके की तरफ से भी हमें कुछ चीजें मौसूल हुई हैं. वी हैव शेयर्ड आवर डॉक्यूमेंट्स विद देम, वी हैव शेयर्ड द प्रोसेस के किस तरीके से वी हैव अडैप्टेड इट. So yes, Sindh is very much ready to support other provinces, other regions, you know, to support them to build their own LSB mechanism.
Thank you, Dr. Fazia. Dr. Talib, Assalamu alaikum. Are you online with us? नहीं है?
Can I ask a
Okay.
question?
Yeah, please.
So, Dr. Fawzia, I mean, that was very impressive what you've just said, and especially with LSB. I've seen outside Pakistan that one of the models which is really effective in building up life skills for young people is a peer model, peer education model, which works at the school level, at early teens, etc. Have we? I mean, it could be a very silly question, but have we ever tried it, and have we used that model? And do you think this can be effective for premarital counseling? Because that's
one effective model.
there's a way to communicate and ask questions and be open, all of that.
Thank you so much, Azia. So yes, we do have these wash clubs right now. Wash clubs मौजूद है हमारे पास. Now these wash clubs are the TORs. There are very descriptive TORs of those wash clubs, and mainly they are for the students जो schools में मौजूद हैं. But देखिए हम we are not in a position right now to directly, you know, discuss on reproductive health, because अभी तक जो हमने चीजें किया है वो is making ground for it. See, जो LSB का framework मैंने बताया, one of the component of that framework is reproductive health, which is for senior classes 9 to 10 वाले के लिए. Yes, we can, you know, focus more on these wash clubs. उनको हम ज़्यादा strengthen कर सकते हैं with respect to the peer, you know, जो चीज़ बनती है उसके हवाले से. लेकिन ये मौजूद है, but उस तरह नहीं है. Yeah, we can strengthen them. Thank you.
So before Dr. Kusia Shadina, can you tell, you know, the Aman telehealth experience related to callers from pre-marital counseling, and do you think telehealth can have a role in pre-marital counseling?
So we do a lot of counseling through telehealth, but that has not been our main focus up to now, right? So we have been handling calls and queries about general health. And we have noticed over the past 2 years, especially when we were working on SOGP, because we introduced the family planning reproductive health element in it, that we were able to bring that discussion in with a lot of callers. What really changed the whole paradigm, it was a paradigm shift for us during COVID, was that our calls went up from 35 to nearly 1,000 a day.
Wow.
So we were receiving 1,000 calls a day at our telehealth. And what we started doing was, based on the profile of the callers, we started counseling on family planning, reproductive health issues at that time. And so, yes, we do a little, because our HAIOs have been trained on LSB as well. So we do some premarital counseling as well. But I think the future, and learning again from the COVID experience, is to go into video counseling, which is possible through telehealth. So that's what we are trying to introduce over here. So we're expanding the scope of telehealth to go into video counseling, because that gives you confidence when you see somebody whom you're talking to. And that also encourages couple counseling, because that it becomes easier to talk to somebody who is there and you can relate to.
And in your privacy, in your room,
In
and
your privacy. So telehealth has two main advantages, really. There is complete anonymity if you want it, because you can call the number and you can talk to somebody without really showing your face and being there present and ask difficult questions which you would not to anyone. And then there's this other aspect of it where you can actually get to know who your counselor is and ask questions. So we are actually developing that
That
aspect
process,
in
okay.
it along with chatbot. So we're introducing a chatbot in it as well. So some of your frequently asked questions can also be handled. And I think premarital counseling, sexual and reproductive health counseling, really weaves itself so well in all the general questions that are coming to us. That is what we have tried to build up
Built
on.
up. Thank you, Shadina. We have Dr. Talib online again. Dr. Talib, sir. नहीं अच्छा please Dr. Yasmin.
So what Shazina was telling and what we have been talking about, that how can we integrate this as a part of a regular
आप
consultation.
माइक थोड़ा आगे कर लें
How can we do this? Arya,
जी
that when we're talking about the health providers, we're talking about other professionals who would be counselors. We have to work on one angle very, very critically, and that is provider bias.
ठीक
Whether it's a telehealth counselor, whether it's somebody in person, because we have so many of our own personal biases. And anything which is as new and as challenging, talking to young people at an early stage, whether it is LSP or pre-marriage counseling. I want to come back to pre-marriage. I know that we have talked about LSP in a great length, and it's a great launching pad. How do you prepare young people so they can be engaged effectively? But I think provider biases are very important to deal with. So any initiative that you're going to take to the ground, make sure that providers do not, bring in their own biases.
so Dr. Yasmin, Pathfinder ने जो provided bias पे किया था, we have not heard back from them. I personally don't know any update on that.
So Beyond Bias is a multi-country project that Pathfinder today's coordinator is to make. Pakistan is of course one of them. It is at the last stage, it's going to be disseminated soon.
Okay.
And they have come out with the solutions, and it's kind of a human-centered design study that they have done. And it's not surprising, but we saw a lot of biases, especially with the young people. Comes and talks about anything related to family planning. So there are so many biases. So that study will be definitely disseminated in the next couple of months or so.
Thank you. Do we have? Okay. So, Dr. Kusia, everything in health comes under the ambit of WHO. So we acknowledge that. But why WHO from that action point selected premarital counseling as an intervention that they would like to, provide resources to?
Thank you, Dr. Harris, for this question. I think looking at the national level momentum that was built by the action at highest level of the government office, that's the Prime Minister level, and the task force that was formed and their key recommendations. So WHO basically picked this particular recommendation as it is very much in line with our mandate. WHO is a technical agency, and we were keen to provide strategic guidance on areas related to family planning where we can make a dent. So family planning, premarital counseling on family planning was a key recommendation, and we thought there was a lot of room to contribute. There was already some intervention being supported by our sister agency UNFPA. There was some policy level support in terms of a study tour to Iran. Dr. Yasmin talked about the Iran model. So there was an intention to learn from Iran and replicate that model in Pakistan. However, there was, I think we all know that Pakistan is such a diverse country that we needed to have something more contextualized. So with that intention, WHO basically undertook a scoping exercise to learn about what successful models are there around the globe, and also to explore the perceptions of key stakeholders. So this scoping exercise also included interactions with stakeholders like parliamentarians, like religious leaders, local governments, program managers, and it was eventually recommended by that report that we needed to have a model that sort of is contextualized in our own setting. So that was the reason we started working with the directions and guidance from the ministry. And thanks to the Forum for Safe Motherhood for providing this very extensive support and cooperation in terms of defining the multi-touch point model. I think the importance of this model is very much enhanced with this with our global and also local learning from COVID situation, where online interactions and virtual interactions have become the norm of the day. So I think there was a need for a self-learning tool as well. Dr. Saib also talked about bias, provider bias. So I think this tool basically also makes it easier for anybody who wants to learn more in depth of the topic, and it totally avoids provider bias as well. So there is, I think there is extensive information available on this self-learning tool for different levels of audiences. We developed it in English to begin with, but I think our respected audience also highlighted there is a need to reach out to a much wider and much broader range of stakeholders. So we are now translating it into Urdu, so that, and I think we all know all the students have basically now been so much tuned to online learning that such a learning tool would be basically something that can be very easily accessed and understood. And then I think it also, we all know that young children are in search of information, and there has to be some valid information portal that provides them the right information in the right way. And I think this tool is basically serving that role. So that if there is any search for information by young people in the country, they can reach out to this portal. There is definitely a need for very wide and broad dissemination of this available tool, and I think I can probably safely make this request to the audience here to make sure that you take away this website address and spread to your networks as far as possible. We will definitely be putting in all our efforts and contributions to
Yep,
make sure
and
that it reaches out to all the provincial stakeholders. We have in our plan to translate this into Urdu and Sindhi. Dr. Haris mentioned that earlier in the session, and maybe in some other regional languages as well. And that's basically to make sure that it can be accessed and understood by majority of our population. The web portal is also providing a link for read alouds for people who can not probably read more easily. So the intention is basically to target various segments of the population, the educated ones, the uneducated ones, and so far. So I just wanted to highlight these specific elements of the tool, and I'll stop here.
Yeah. Dr. Talib, Assalamu alaikum. Unfortunately, we could not take you online, but are we all audible to you? आपको थोड़ा सा ऊंचा बोलना पड़ेगा. Thank you very much, Dr. Talib. Quickly, before you go for your next meeting, what is Government of Sindh doing for pre-marital counseling? There's a lot of discussion since last year, I think before that also. So pre-marital counseling क्या सिर्फ life skill based education तक है या सिंध गवर्नमेंट इससे beyond देख रही है, especially in health and population welfare department? Dr. Talib.
Thank you, Dr. Harris, and sorry for the technical issues, not being able to connect at this August house through my laptop or cell phone, but I'm thankful to Washington Alliance and Dr. Harris, yourself, for this opportunity. I couldn't do that. As you know, since government has initiated the in the early stage, we were discussing on pre-marital counseling, but later on we thought it is appropriate to have marital counseling. Marital counseling is also part of the PCI recommendation, part of the CIP, part of now is the 2030 roadmap. The marital counseling, previously we thought should be a separate bill, but then based on the law department comments, observations, we decided to make it a section of the Reproductive Health Act 2019. So the RH Act, the section has been created in RH Act. So it will have the role of local government and council, and the Nikahnama will also be amended accordingly. Section after getting section, and also some other sections like vaginal health surveillance and some other important areas. The RH amended bill has been now approved by the Sindh Cabinet, and it will be now presented to the Sindh Assembly anytime in the coming days.
Dr. Alip, thank you very much. Unfortunately, I think the system is not very clear here. We'll try to have some recording of you available of your comments and thoughts when you are back in Karachi. But really, thank you for giving us your time. And sorry for this technology glitch. We would like to thank you for this call now, because we need to, we are really very. Audience was not able. We were not able to. I was the only one who could do it. So I hope you can record a message that we can use it later. Thank you very much, Dr. Ali. Okay, so we are closing our session. Thank you, everyone. But before we close, I really like to see if anyone in the audience have a quick question or comment. Yes, sir, please. Yeah, please. We have a mic or we don't have a mic? वो चला ही गया mic. भैया mic उधर दीजिएगा. वो अच्छा चले एक सेकंड.
Assalamu alaikum. I am Professor Shamsa Humayun, Head of Gynae Department from Fatima Inda Medical University, Lahore. I have one comment and one suggestion. It's a great initiative. I would like to congratulate all those who have worked really hard. My suggestion is for the dissemination. हमारा जो भी काम होता है वो मैंने ये देखा है कि एक certain level पे आके वो रुक जाता है. Same with that, because I work with the family planning very closely. My suggestion is effective utilization of electronic media. Cables जहाँ पे हैं वहाँ आप अपनी website कर सकते हैं, आप FM radio पे कर सकते हैं, क्योंकि हर बंदे के पास फ़ोन या कंप्यूटर या उस किस्म की फैसिलिटी नहीं है. तो it's very important कि आप सिर्फ स्कूलों या वहाँ पे तक ना रहें. जो मैसेज and those who really need all those things, the message should be conveyed to them as well.
Thank you for your suggestion. सर आपका एक क्वेश्चन था जी पीछे अगर
Thank you, Dr. Hars. This is Lutf Mangre from Sindh Integrated Emergency Health Services. सिंपल क्वेश्चन है कि जो हम प्री मेच्योर काउंसलिंग की बात करते हैं तो हमारे कम्युनिटी के अंदर और स्कूल के अंदर स्कूल को हम रीच करते हैं यंग पीपल को बच्चों को थ्रू एजुकेशन इंस्टीट्यूशन और कम्युनिटी में जाते हैं थ्रू लेडी हेल्थ प्रोग्राम कम्युनिटी हेल्थ प्रोग्राम टेली हेल्थ एंड मेनी मोर। सवाल ये कि हमारे स्कूल के अंदर बच्चे जो हैं वो आफ्टर 5th grade ड्रॉप आउट रेशियोज हाई स्पेशली फॉर द फीमेल चिल्ड्रन और जब ग्रेड 5 पे 10 पे पहुंचते हैं तो इवन ड्रॉप आउट इज हायर और जो ह्यूज बल्क जो यंग जो प्री मेरिटल काउंसिल चाहिए दे आर आउट ऑफ स्कूल और जो लेडी हेल्थ वर्कर प्रोग्राम और कम्युनिटी हेल्थ वर्कर प्रोग्राम है हमारा वो भी आफ्टर मैरिज उनके इंटरेक्शन पे फोकस ज़्यादा है दो दे हैव देन द प्लान कि वो पहले भी इंटरेक्शन करें लेकिन फोकस जो है इनका वो शादी के बाद में तो बीच में एक बड़ा चंक जो है ना वो यंग बच्चों का रह जाता है जिसको प्री मैच्योर काउंसलिंग की ज़रूरत होती है। हाउ डू यू सी कि कोई पैनलिस्ट में रिस्पॉन्ड करे कि इस बड़े चंक को हम कैसे एड्रेस कर सकते हैं? थैंक यू।
एनीवन फ्रॉम द पैनल? शाजीना, लुत्फ आपको माइक देना।
Thank you. So I think it's a great question because that is the bulk of the girls or young adults who need that counseling. And a lot of you know it very well, that the link can be telehealth. The link is where they can access that information sitting in their houses, being wherever they are, and they can talk to the counselors, they can get their information through telehealth. I totally endorse what you said. Telehealth can be successful only if those numbers are available, they can be recalled by the person who needs help. So in media, in all kind of advertisements, the number needs to be told time and time again on what the number is. But I think that the most interactive method of counseling would be a telehealth center. And that is why we are trying to promote that. Thank you.
Thank you, Shadina, and thank you. I think we have another session at 9:30, and we are, eating up their time. So really, the discussion was now warming up at the time when we really needed to talk more. But I would really request Dr. Shamsa Hamayu and Dr. Nasir Shah to please come on the stage and give appreciation shield to the panelists on behalf of SOGP. So first and foremost, Dr. Yasmin.